Let's talk about these little red dots that happen on the skin and if there's something to be worried about or if they're not. Hey guys, I'm Dr. Laura Soong, board certified dermatologist. Welcome to my channel. I'm here to help you guys understand your skin and give you tips on how to take care of it. You may have noticed these little red dots popping up on different areas of your skin. A lot of people grow these small circular red to purple dots on the arms, legs, the torso, the scalp, and they can bleed if you nick it with rough clothing or if you accidentally scratch them. They can increase in number over time. They're usually bright red, but if the blood vessels are a bit deeper in the skin, they can be a darker purple color, and they sometimes start to stick out like a skin tag. These are all cherry angiomas, and I see them pretty much every single day, like all the time. And they're small collections of blood vessels in the skin that form this little growth. Now, we're not exactly sure what causes them, but they seem to come with age, pregnancy, and certain gene mutations. Actually, over 75% of people over the age of 75 have them. And they can also form in teenagers like 7% of the time and young adults. I even have a few myself. Now, most of the time they're harmless, but there is a specific type where you can get something called eruptive cherry angiomas, where you suddenly develop like hundreds of these things seemingly overnight. And this can be associated with certain medications and sometimes underlying blood cell disorders, but this is really rare. Now, dermatologists, we're very used to seeing these things and we can easily diagnose them just by looking at them and sometimes doing dermoscopy where we use our little fancy magnifying glass. They have very characteristic features under that. Now, we don't usually need to biopsy these things unless they're growing really fast, bleeding, forming a sore, they're very painful. In that case, we do like to remove them just to make sure they're not some sort of skin cancer, something like an amelanotic melanoma, or a reactive growth called a pyogenic granuloma, rather than a cherry angioma. And anything doing these kinds of weird things, bleeding, growing, whatever, should be checked out. Now, these little growths don't need to be treated, but a lot of people come into the clinic because they want them off. They don't like the way they look. So basically for cosmetic reasons. In that case, there's a few different options. Now, people have tried to burn them off with liquid nitrogen, which in my experience doesn't usually work very well. One treatment that does tend to help is something called electrocautery, where we actually use electricity to kind of zap them off. And then another great treatment is something called laser therapy. So you can use blood vessel lasers, something like pulse dye laser, for example, or PDL, to specifically zap the little blood vessels and kill that little growth off. I think the laser treatments are nice because they have a less risk of scarring and tend to be quite effective. Now, if they don't bother you, you don't have to do anything about them and you can just leave them alone. But if they do bug you, then make sure you see your board certified dermatologist. We're happy to discuss the treatment options to remove them and give you that clearer skin that you wanted. Well, guys, that's it for this video. Short and sweet. Hope you enjoyed it. And if you want more content like this, make sure you subscribe to my channel so you don't miss any of my future videos. We'll see you in the next one.